What's going on in the nursing industry? Is it as bad as we think it is out there? Because we know so much has changed since COVID and the amount of work these nurses are doing. So let's talk about that and start with the conversation.
Yeah, certainly. I wish I could say it wasn't, but it is, really. One major factor in my role is working with the American Nurse Association, and the statistics are real. And really what we're looking at in the next year, the bedside nurses, 45%. Are really saying they're leaving the bedside.
Oh, wow.
So
45%.
45%. We're talking 2 million nurses out of 4.2 million nurses plan to leave in the next year from the inpatient setting.
Wow.
So the work we're doing is so important to support them.
Yeah, I had no idea it'd be that many people.
It's big.
That's wow. Okay, so we're going to be losing a lot, potentially.
Yes, potentially.
But hopefully with what we're going to talk about today, that might not happen.
That's right.
There we go.
That's
so,
right.
See, we're going to do some good today.
That's right.
We're going to do some good. This is really no big surprise, is it?
No, unfortunately not. We knew post-pandemic we were hearing some of these numbers, but to continue to hear this, it's definitely, still, it's disheartening to hear it. But, we're partnering, we're bringing a lot of technology, a lot of digital solutions to fruition, which we think can help alleviate some of that burden. For sure, I think we've talked a little bit about some of these solutions before, but the opportunity, I think, really is going to be from a data standpoint when it comes to digital and technology, and really to be able to tie those data points together, which are going to be able to alleviate some of the burden off of our nursing staff.
Yeah, certainly. And really, when they talk about leaving, the number one reason is increased workload. So what we do to eliminate that is so important.
Yeah. Let's talk a little bit about how technology is starting to affect the field. Like, for those of us that say, have no idea what's going on with technology and nurses and the hospitals, what are some of the groundbreaking things that are really making the nurses' jobs a little more easier, a little more tolerable? Can you elaborate on that some for us?
Yeah, certainly. I mean, technology and clinicians partnering, how brilliant is that? I mean, we look at solutions that eliminate some of the redundant tasks of nurses that are administrative, allowing them to be back at the bedside. So whether it's retail solutions, bringing sustainable food, nutrition to the nurses, or whether it's the digital flow workboards that prevent the nurses from being on the phone for long periods of time. So those are some of the solutions that I've seen across the country that really are pertinent to keeping the nurses at the top of their license.
And Simon, it continues to evolve too, right? I mean, there's a solution for something, but then something else comes up. And technology, like in all technology, it just keeps evolving, doesn't it?
Oh yeah, absolutely. One thing for certain with technology is that it's going to continue to evolve. And our group within Compass, Healthcare Digital, that's really our role, to partner with Andrea and other clinicians that we have in-house to make sure that what we're building from a technology standpoint, we want to ensure we're not just building technology for the sake of building technology. We want to ensure that we're partnering, we're bringing solutions that are going to bring some of that relief, whether it's from a workload standpoint or to just simply give nurses access to food on their shifts when they're running around for 12 hours focusing on patient care as opposed to themselves. So
that's a good point, because we know that, looking at the ANA data, 70% of the nurses will prefer their patient's care over their own self-care, which is the servant heart of the nurse, right? So when you talk about bringing sustainable, healthy options to the nurses, it's really important.
Yeah, and to elaborate a little bit on that, technology is really making retail on the floor a reality, right? I mean, and expand upon that for me, if you will.
Yeah. So something as simple as think about badge pay integration. So usually on a 12-hour shift, typically a nurse, they're probably not going to be carrying around cash or a credit card. So for us just to be able to take a badge, integrate it, and put in truly frictionless options. So something like an Amazon Just Walk Out.
Okay.
For us to do that, that might allow them on a 12-hour shift to walk in with their badge, get into the space, grab something to eat, and just otherwise they might not have had that opportunity. And then there's just simple things that, this day and age, mobile ordering for them to, from the nursing floor, put in an order and then walk down to the cafe and have that order available for them. Self-checkout. So lots of opportunities. And then we're also taking that technology up to the nursing floor as well. So from a retail standpoint, maybe not even having to walk downstairs. We can take that up to the nurses' lounge, to the nurses' station.
Gotcha.
where they can, again, get access to that high quality food, healthy food as well.
Yeah. Speaking of technology, phone wait times, that's one of the most prevalent, I would call a clerical task, keeping a nurse from practicing at the top for a license.
Okay.
We're going to talk a little bit about that and how healthcare digital really supported what we see. What we see is an opportunity to improve and decrease those wait times on the phone.
And nurses, nobody touches a patient more than a nurse.
Nobody. That's
So the technology that they're going to be able to, that's going to help them with that whole process and their time management and everything else. Talk a little bit about that, what's going to happen there.
So it's a partnership. Our team with nursing, the patient's at the forefront of everything we do. So when we work together to bring these solutions, to look at workflow processes and how our team can also put the patient, but not only the patient, the clinicians in top of mind, we're going to see that partnership grow.
Yeah, and just to elaborate a little bit more on that, so the solution that I think Andrea is talking about, so in collaboration with Andrea over the course of the past year, we've developed a first application that's designed for our nursing partners. So It's a simple, at-a-glance, real-time, data-driven application. Just gives them insights into our operations where a meal is, whether it's been placed, whether it's been delivered, did the patient decide not to have the meal. So that's already, we're starting to see alleviating some of that burden from a nursing standpoint where we've heard there's upwards of 50 calls a day that can go back and forth between our staff and the nursing staff where they're just trying to get that status on that meal. And with implementing the solution, early successes, which I'm sure you can elaborate on.
I can. It touches my nurse heart to hear that, because when I think about, she said 50 calls to one call, you think about that, the time spent, wait time, tracking meals, ordering meals, supporting the meal process.
Right.
And now with digital technology, it's at a glance. And so that's time back for the patient at the bedside.
And we all know time is the most important thing,
most
right? When it comes to
That's
that.
right.
I think it's fascinating too that the technology is there to speed up things, to make it more efficient or whatever. But the data side of it to me is what I think is really amazing too, because you're collecting data the whole time.
Yeah.
So then that allows you to really hone in more and more on what's working, what's not working, what the patients want. And just elaborate a little bit on that to me, as far as like being able to really go in and get in depth with all the data.
Yeah, so really good point. I think across Compass One, we have access now to more data than ever, whether it's through third-party partnerships or it's through our own proprietary solutions. So it's starting to give us that whole hospital insight.
Right.
So from a Compass One account, so one example I like to give, and I think this is going to be close to your nurse's heart again, is something as simple as we should know with the data that we have if a patient is being transported for an x-ray or an MRI. So using that data in real time, just sending an alert down to the kitchen and saying, please just don't deliver their food until they're back.
I didn't even think about it. Right.
Yeah.
Okay.
So if we're able to do that with, tying all the data together in a Compass One account, again, so when the patient comes back to their room, from a temperature standpoint, if the meal had been delivered, they're probably going to call the nurse who's going to call down. So from a workflow alignment standpoint, from a communication standpoint, the access to the data that we have, we're going to continue to piece it together to really have that differentiator.
Yeah, that just echoes what he said about time, the most valuable asset.
Right.
That just really brings that home.
It's just efficiency. I mean, it really just boils down to being more efficient and really honing in on what works.
Yeah.
That's great. Yeah. What do you think the nurses are most excited about when we bring technology like this to them? And they got to be excited just from the fact of, obviously with technology, as we all know, there's a learning curve, right? You bring in new technology, whether it's new software in your computer or whatever, everybody's always like, I got to learn something new. But when you do, you realize how efficient it is and how really it saves time in a day. Is that accurate to say the nurses are kind of in that same boat with that?
Absolutely. I think what they're most excited about, you asked that, would be that we consider them. We're considerate of keeping them at the top of their license, and that we value the partnership so much so that we're listening. We're rounding. Nurse rounding is so important, and our teams, they understand that. So we bring this information back. We work with our teams, but I think that's the fact. The fact is that we prioritize them and we understand the value in our partnership. And so we're listening.
Yeah.
And they're excited about that.
Do you think you would give that advice to our partners out there, stuff they work with, the nurses? Like, that's really what nurses need, is just to listen, to be heard, and to be kind of valued that way. Is that fair?
Absolutely. And, keeping them at the top of their license, partnering with services such as what we're bringing to the table, that's so important. Just listening, understanding, and then the partnership.
Yeah, no doubt. Simon, one last question for you. Where do you see the future going? I mean, I know that's a hard question to answer when you talk about technology, because, Apple puts out a new phone every 6 months. There's always something new, something faster, something better. But what do you see, especially when it comes to nursing and in the hospital setting?
Yeah, I mean, for sure. I think we talked about the data piece of it. Data is going to be super important just going now and into the future. So we're making sure that we're utilizing all the data that we have in-house, not just from a nursing standpoint, but also from a patient-centric standpoint as well. There's a lot that we're doing as far as putting patient at the core of everything that we do. So from a healthcare digital standpoint, we're building solutions for our nursing partners, for our non-clinical hospital staff, friends and family that might be in and out of the hospital. We're introducing a patient application for them to be able to download this app and order their own meals, as well as for our operators. So our goal is always to keep that patient in the center of everything we do for that patient satisfaction piece.
And that is an emphasis on patient safety,
Right.
Yes.
on improved patient outcomes, patient satisfaction. But at the forefront, it is patient safety, because when we bring the nurses back to the bedside, we increase the safety. So it's so valuable.
And I think what the key to what you guys have both just said, I mean, all of this discussion and where we're all in this business, yes, the technology is great for the nurses and helps their lifestyle, whatever, but that in turn then helps the patients.
Right.
And everything that we're talking about goes back to the patients.
Yes.
And that's what I know Compass One Healthcare is just all about when you talk about it. Just everything that we're doing to advance technology to help the nurses or whatever is with the patients in mind. That's fair to say,
It's
right?
very fair to
Yes.
say.
Yeah.
It's very fair
Absolutely.
to say.
Yeah.
Patient is at the core of everything we do.
Right. Ladies, thank you so much for joining us here on the
Thank you.
podcast this
Thank you.
afternoon. It's been a pleasure having you both, and hope you enjoy the rest of the conference. But thank you for
Thank
being
you.
here.
Thank you. Thank you
Okay.
for having us. Thank you.